What? What's that? Was that?
Yes.
Oh, okay. The owl was talking. Okay, so we had enough quorum, to have a meeting. We lost a couple people. We gained a couple people, so it's shifting around. We have 12 right now. We need 14 for quorum. Julia LG and Carol Staffel are on their way back from ECMC. They took a call there. They're going back to Bliss and coming here. We can't technically vote on anything. My suggestion is we start working through the reports and the discussion. And then we can, when we get those two show up, we can take any actions that we need to take and go from there. Since we can't vote, I'm asking for a motion, but just asking, does anybody object to that plan since we're already here? And we might as well get through the stuff. Thumbs up's not an objection, it's an affirmation, right? Okay.
And I thought you were giving us signs to like steal second face before when you were fiddling with your fingers, and I'm like, dude, the old story.
No,
You're,
there's counting and yeah,
I get it.
it was a moment, but if you want to steal second, by all means, Dan, go for it.
Now I'm a soft player.
Okay, I think we can do the pledge of allegiance without, or. We're done, if you want to start.
Sure. I pledge
allegiance to the flag, the United States of America, and to the republic which stands for the nation, under God, indivisible, with liberty and justice for all. Thank you. So we'll listen to any public comments. If any member of the public is here and would like to comment or raise issues for discussion, we'll have a moment of that. Okay. Hearing none, we'll dispense with that. We cannot approve of the August minutes. Oh, I can't approve of any minutes, but we do have an amendment to the August minutes and just want to note that for the record that Crystal and Robert Tatarka's last name was misspelled in the minutes, so we'll have to correct that to the appropriate spelling. And once done, we can entertain a motion for approval, or we can do that conditionally. I don't believe there was any correspondence distributed. Do you have any? Or does anybody, as I'm looking, have a note of correspondence from Chris? So correspondence since our August meeting was September 16th. We had a course approval notification for AMR with Mo Farden as the instructor, and September 26th into the original and Agraboses with Hogue as the instructor. So that's the correspondence that we've received and logged since our August meeting. Treasurer's report, and we won't be able to take a motion on it yet, but we can at least have the report.
Since our last meeting, we've only had 10 expenditures. We had totaling $885. One was for general counsel matters for Mahoney Law Firm, and then Taffers for the awards for our annual dinner. Are there any questions on my report? I also did, payment was made to Cater Creations for our awards dinner, and Lynn Stryker, Bill's wife, who had gotten, purchased some refreshments and so forth for that, and that was not taken out of our other account from donations, because we're not able to take any type of food items out of our regular monies received from the state. And that totaled, we had Twin City Ambulance Support received $1,500. And then there was $1,900 and some dollars for the awards dinner. And we do have a balance there of $2,699.34. I did not spend this. Any questions?
Sounds like no questions for the treasurer's report. Medical Advisory Committee, last meeting of the REMAC was on September 17th. Just looking quickly over the notes, the bylaws were returned to the bylaws committee for review. The stat medevac 2025 protocols were approved. There were a couple of medical director changes, public access defibrillation notifications, and discussion on physician response on scene healthcare professionals and BLS 12 lead policy. A lot of action in the works, but there is nothing current that I'm aware of. The next meeting is scheduled for November 19th at 1:15. or maybe 1:30. My calendar could be off. Anybody have any other comments who attended the REMAC or who, anything for the REMAC? Goes a lot faster when we don't have to have motions. State council, Greg did not provide a report, from the state council. Next meeting is December 4, 5, 6, 5, 6, 7, stand by. Next state council meeting is December 9th and 10th. The last state council meetings were in September, so we have not done a report on that yet. No, Mike, do you want to update on state council? I pull up my notes and see if there's anything that you missed.
Sure, did include just some highlights in my program agency report, but, things that came up were, EMTCC level, the first deputy commissioner was there, Dr. Heslin, and, he had noted that the, commissioner, was not happy with the timeline for the sunset date, and asked that it went back to go back to committees and take a second look at it. But I think there was a lot of misinformation there, some things that the first deputy commissioner now realizes. So the CC level, from what I'm understanding, is definitely going to sunset. It's just when. So that's going to come up again. Equipment regulations were voted on and approved. And that we actually just sent out correspondence regarding that, and the changes. Ambulance build standards, those were reported to be in final review, for the first public comment period. There was some talk about the supraglottic airway for BLS providers. That's moving through review for final policy. There was also discussion regarding the BLSFR agencies. They are currently excluded from the supraglottic airways for the VLS providers. That has a lot to do with regulations, and so there's going to be a discussion opened up regarding that, and what that would look like down the road. As a report from education regarding National Registry, there are some IT issues causing a lot of trouble verifying National Registry testing and other educational records. So it makes it a very tedious process for state EMS. The recommendation is if you're opting to, well, currently you can opt to take National Registry and that becomes certified through New York State after the fact, but there's a waiting period involved in that. Recommendation right now was that, take the New York State test and deal with National Registry later. Let's see, what else here? Just a lot of other reports on, discussion on RSI. RSI statewide, there was discussion on that. So I'm sure that's gonna be something that we look at down the road. So that's pretty much it for the major items, I think.
Yeah, I think, and thanks for buying me time. Just a couple of notes for those who were not able to attend. That also came up for agencies that are billing the Medicare extenders did not get through in any bill prior to the government shutdown. So the extenders of 2%, 3%, and 22.6%, representing urban, rural, and super rural, are not currently being paid from October 1st through present. The hope is that will retro. Medicare is still paying, so at least that's still in place. New York State is submitting, as part of its package for the rural health transformation funds, EMS initiatives. Those seem to be focused right now on education and mobile integrated healthcare. So we'll see ultimately what those things look like, and if we're able to get access to any portion of those funds as we're starting to look at the federal distribution. I think maybe the relationship between New York State and the federal government could inhibit some of that, but we'll see what happens. And then on the legislative side, we've talked about the pending legislation for the tax cap exemption and for the comprehensive plan assessments. Those are still sitting either on the governor's desk or not to the governor's desk. I believe that there's right around 200 bills right now that remain from the last session that will have to be dealt with before the end of the year. So nobody knows what's going to happen with those. The most recent thing I've heard is that there will maybe be a chapter amendment to the comprehensive EMS plan bill, and there will maybe be a veto to the tax cap bill, but those are still maybes, and who knows what happens. And also they're still waiting with the shutdown. It's not happening right now, but the state plan amendment to allow for payment of treatment in place and transport to alternative destination from Medicaid is still pending. And then in terms of work groups, there is a work group that is taking a pretty deep dive on public need and the CON process. I would not call it 0606. It's taking a much deeper look, looking at other practices and processes, but everything works at the speed of government. So we'll actually see something on that in 2028, 9, 10, whatever those are. I think that's mostly it, right? So anything for state council? Again, next meeting's early December. I don't think there's anything overly hot button there, but haven't seen the agendas yet. Okay, Erie County did not receive a report in advance. I don't know if anybody's here tonight that can speak on behalf of Erie County.
I did, so, just got notes from Greg, but I want to thank the council committee for the rapid response to the county's operating authority. We do have an EOC operation planning meeting tomorrow in anticipation of the weather change. The hot topic for the EMS advisory board, post bus crash has been the mutual aid plan. The state is very, active in, discussing a regional MCI plan. Where that's starting is with communications. Having a channel where we all are able to talk to one another. Whether that's 340 still, that's still programming ambulances, because it was, some agencies have phased it out. And coming up with a true plan to share with all the other agencies and amongst the other counties that are involved in that as well. So that's being bounced back and forth between the emergency managers, EMS, everybody's kind of talking and discussing about it, and there's more to follow with that. So just parlaying off the bus crash, unfortunately, but it's at least getting us all in the same room to talk to each other about working together and the need to work together. From the education side, the paramedic graduation for the Erie County class is November 20th. With a speaker series next week and in December. And they're opening up 2 paramedic classes, 1 daytime, 1 nighttime next year. They received their accreditation for the education program, and we have CME. For the Erie County EMS, as of last week Friday, they've taken 3,800 runs, transportation about 72%. Hiring EMTs and paramedics for anyone who wants a job. There's a third 24-hour paramedic ambulance being started now. 2 more are on order for a total of 7. And he's adding 2 more flight cars to the LS First Response. COVID clinics are in process. They're random all over the place. So if you need a shot, let us know. And that's about it.
Thank you. Anything for Erie County EMS? Okay, Wyoming County. Anybody have a report from Wyoming County? Mr. Stryker wasn't able to attend tonight. I'll take that as a no. West New York Stress. Mr. Atkinson, do you happen to have notes there too?
There are no numbers to report. That's here.
Thank you. Wyoming County First Responder Support Team. And nothing available. On to committee reports. Budget, Ms. Barber.
New business,
Okay, yeah, we can do that in new business.
nothing to report at this time.
No report. Membership, Ms. Mestrella is unable to attend tonight. Does anybody have a membership report? Okay. Systems Committee, Mr. Maxian.
Your report?
No report. Training and Education Committee, Mr. Zemrak's unable to attend tonight. We should all send him well wishes as he is currently, well, he's probably off the anesthesia at this point, but currently recovering from a surgical procedure. We gave him a pass for obvious reasons, although I'm sure it would have been fun to have him here under the effects of anesthesia. I think the only thing of note for training and ed, and this will come up with, program agency as well, is getting the Training and Education Committee together with Mr. Shaw and our program agency to deal with, the paramedic, scholarship grants, the $20,000 that'll flow through the program agency to identify selection criteria, application criteria, how we can get access to that. There's already been a pretty significant time lapse since that was introduced, and I think we've missed out on the first year's funding, for that. Mr. Shaw's nodding his head, so yes, but getting the Training and Education Committee together, that's at least 2 people that we can, as a region, send to paramedic school at no cost through, what would be a qualifying criteria and something that we can verify, so training and get a bite at that apple. Bylaws, Ms. Staffel should be here shortly. I'm assuming no report, as she and I have exchanged emails where she's still waiting, for me to provide some notes that I'm trying to turn into English because I can't read my own handwriting, to be able to help with that process. Awards, anybody on the awards committee have any? No, and just want to commend again that committee and Mr. Stryker for a fun and enjoyable event that we had at Strikersville back in August. I think it was an enjoyable evening. Always look forward to those.
I believe our youth provider actually is being recognized with vital signs.
Very nice.
Yeah. Cool.
So our youth provider was awarded the statewide
Yes.
recipient.
Yeah.
Great story. Recruitment and retention, adding that as a committee, it was added as a committee, adding that as an agenda item, for a committee. The members, that volunteered initially for that committee are Jessica Graham, Mary Beth Hughes, Sean Halsman, Michael Hyde, Crystal Tatarka, and Jeff Segota. Like for at least those of you who are present, if you can convene for a few minutes and we start the process of selecting a chair. We do need that committee to also work in partnership with UBMD and Mr. Shaw on the recruitment retention funds. I believe that one's a little bit more. That's a 30,000 total on an annual spend. For recruitment retention plans for the region, so.
Yeah, I think it's 15,000 a year.
Okay. That's gonna require, some analysis and needs assessment, but, getting that committee together to start to go through that process. Do the analysis of what's currently being done in the region, what can be added to it, how can we make for a more robust recruitment and retention plan? So if, as far as who's here tonight, if Miss Graham, Mr. Zgoda, and Mr. Tatarka could get together for just a couple minutes and see if one of you wants to volunteer one of the other 2 to chair. Go from there. Everybody's familiar with that grant. Any questions or issues with the recruitment and retention committee? Okay. New York State DOH, we do have to get that corrected from Mr. Major to Mr. Winsky. But anything from DOH?
Vital signs, there is still time if anyone is interested. Online.
And can you just remind us of the dates of vital signs? It's November.
That is next week. It is the 11th to the 15th.
Yeah, so vital signs registration remains open November 11th through 15th. First come, no waiting, right? Anybody have anything for DOH? Okay, executive board has not met. There's been nothing that we've had to tackle, at least in the interim, so I expect that we'll be dealing with some stuff in the coming weeks. Program agency, Minister Shaw.
Okay, well, this is my first meeting back. On behalf of UBMD, I would like to say thank you to the council for your support with the UBMD reinstating program agency functions. It's well appreciated. So currently, the staff is myself as the program agency director and Karen Broderick is the administrative assistant. So if there's any anything that you need on behalf of UBMD, you can contact either one of us. Our information is on our website. A lot of you already have my information. It hasn't changed from when I was in the position before. Some things we're working on right now, we're working on reimbursements from 2024, 2025, quarters 1 through 3. It's a tedious process. The execution of the contracts are taking a little while longer than anticipated, but we're getting there. We're in the final stages for last year's contract execution, so. The Western Elite Bridge, we've encountered a lot of problems with that. So I've spent a good fair amount of time with Peter Brody from the state. He was managing that while program agency functions kind of ceased. But we found that there were a lot of charts that weren't actually making it into the bridge. Most of those were from agencies from out of town that weren't in the bridge program. So the problem with that is that Hospital Hub is linked into the Western Bridge. So the hospitals weren't able to pull those charts. That's been completed. All those updates are done. And we're not seeing those errors now. So we worked hard with the data team to troubleshoot all that. There's questions on retaining the administration of the Western Bridge. And I think that's important. And the state also agreed that that's important. That's paid for through the Coverdell Stroke Project. So it's used widely for quality assurance. So I think it's very important that that's maintained on a local level. So with that, tying into quality assurance, we're using the bridge programs, the state and the Western Bridge for quality assurance. We're looking at failures, import-export failures from all across both regions. And I'm now having reports generated every Monday to show what those failures are and to help identify that with some agencies. We were able to identify that there were a couple agencies that hadn't transmitted any charts for one agency was over a year because of failures that were never identified. So we're picking away a little bit at a time to identify that and fixing and helping them fix those problems. We're looking at possible portal updates. One of the updates that was brought up last year was changing the wordage within the portal from online, offline to compliant, non-compliant. So I did follow up with our developer on that, and as soon as our contract is executed, we're gonna start looking at that, and we've allocated the funding in order to make that happen. So hopefully we can make that happen, because there's a lot of confusion around that. Usage of the portal for reporting annual skills, we're gonna continue doing that. During the program agency lack thereof for the last quarter, there was some communication that said, well, your medical director will take care of your reporting, but the problem with that is that the UBMD portal is a part of the REMSCO, and it holds information for the REMSCO, and the REMAC is a committee of the REMSCO. So, you know, we're going to continue using that portal. I'm going to ask that everybody please stay on top of that portal. I'm by myself in the office with Karen, and she has other duties other than program agency. So, you know, between the two regions, it's 177 agencies. So I can't possibly babysit every single agency. So last year, though, as far as reporting was concerned from Wyoming-Erie, 47 out of 117 agencies use the portal to report their skills. So just a piece of information on that. I'm happy to say that we're going to be scheduling some preceptor courses. We've had a lot of interest in that. Dr. O'Brien, those of you who don't know, Dr. O'Brien is the REMAC chair, has reviewed the preceptor course material. And we'll begin offering skills preceptor courses after the start of the new year. It's gonna be, based on, there's gonna be a PowerPoint presentation and 3 breakout sessions. The breakout sessions are gonna be, quality assurance, and the, preceptor's role in quality assurance, dealing with those problematic, providers. In other words, those providers that are going, oh, I've done it this way for how long, or the person that checked off my skills last year didn't check for this, you know, that type of stuff. And then the third session would be the actual, you know, going through and doing those skills. We're trying to bring some uniformity to it, and I think that's very good. Just to note, the DOH 4362 form has been updated. We're seeing a lot of the previous forms being submitted to our office. So just want to get the word out there that there is an update to the new form. Epitropium's been added. There are some agencies out there that didn't know that epitropium had to be approved by the REMAC. Vital Signs Conference was already talked about. SEMSCO was already talked about. I just want to touch on the recruitment retention and the paramedic training funds that Brian had mentioned earlier. The recruitment retention's 15,000 per year. We did, you know, miss out on the first year, so you know, we've 4 years that we can work on, so that's 60 grand right there. That's, you know, we really need to take advantage of. It begins with a regional survey or a regional analysis. So that's really where we want to tap into recruitment retention and make a collaborative effort to come up with some questions and really paint a path on you know, how our area really is. And we know recruitment retention's a, you know, a nationwide, regional and agency problem, but you know, there's certain steps we have to take by the deliverables in order to receive this money. After that is completed, we've got to develop a plan identifying key areas and pick areas within that plan in order to focus on within that first year. You know, and if that plan needs to carry on, or that key area needs to carry on year to year, you know, we most definitely can do that. The paramedic training fund, that's 20,000 per year. And that again begins with a survey or a analysis of the region, of the area. And then, of course, after that's completed, then we develop a plan based on this grant on how we select those people and you know, how we develop that selection process. So I thought it was very important. I had a discussion with the chair about this. I think this is for the region. It shouldn't be something that Mike Shaw develops as the program agency director. It needs to be something that the region works together with the program agency, because it's money for your region. So, you know, any help with that would be greatly appreciated. They're 2 big projects. That's the end of my report, sir.
Thank you, Mr. Shaw. Just a point of clarification, when you said areas and recruitment and retention, do you mean geographic areas, or do you mean like disciplines or objectives?
Key points.
Okay.
So, basically key points, you know, whether it's, you know, we want to focus on recruitment, you know, this year, or do we want to focus more on retention? I think those 2 areas have to be separated a little bit. And, you know, we know that they're both big problems.
Thank you. Anything for the program agency? Y'all are a chatty bunch tonight. Old business was not noted on here. We should be having our annual elections tonight, but we don't have our nominating committee, nor do we have quorum. So naturally, the elections are gonna have to be pushed till January, and we'll revisit that. So that gives a little more time for all of you who are just chomping at the bit to join the e-board to contact Mr. Halsman or Ms. Stencil and get your name in as a nominee to join the executive board and be able to contribute. So any other old business? Okay, hearing none, new business, two quick things, that we cannot act on unless somebody walks through that door to hit quorum in the next few minutes. Might happen. One is, as Madonna was working through the, budget process with New York State, there was a question about the program agency relationship with UBMD and an updated MOU. Because the MOU predated the, lapse in UBMD's function as a program agency. I think that the best course of action as we're finding our way back to active is probably to just execute an identical MOU, only updating the dates for the active relationship, but keep the terms otherwise the same. I'll open that up for discussion, and obviously we can't act on it, but what's the general feeling on continuing that relationship under the same terms for at least the next year as we start to figure stuff out? Okay, Mr. McCartan, two thumbs. Sounds good as a go-to. One thumb from Ms. Graham.
Two.
She brought two, okay.
Okay.
We have two from Ms. Tarka. Anybody have any objections or concerns with that? Okay, so when we do obtain quorum, I think that's something that will be a great motion, and we can address that. The other thing I wanted to bring up, because it is part of the budget and the spend, just for consideration, I would propose that we undertake a website update. Not necessarily to change the interface, but to change the back end. So one of the things that we discovered when UBMD had the small gap of service, we were trying to manage some things without support, is the website is not built into like Squarespace or Wix, like one of the really easy platforms that you can log in and just change stuff. It actually requires somebody that has some HTML coding skill. And I think that we would benefit greatly from having a website that was upgraded, that we could have password and access, and a committee or assigned individual or the e-board could update things a lot more easily than actually having somebody do the coding. I did have a brief thought in my head that, I learned how to HTML code, and that was a really bad idea. I'm not gonna do that. So I think that, the upgrade's a great idea. The estimate I have on it right now is about 1,500 to bring us up to the update onto a very manageable user platform. Throwing it out there for thoughts, opinions, ideas.
Google Sites is free. And it's very easy to use.
I don't mean, so it's not 1,500 to use it, it's.
Yeah, no, I'm just saying,
Yeah.
like the platform itself for whoever would be maintaining it is very, very simple to use. So it'd be one of those things where, if at some point you have one person working on it and then they have to transition to somebody else, there's very, very little learning curve. So it's just.
Yeah. And honestly, because Bill is not here at the moment, I really think this is something that should be in the awards and PR domain. Makes a lot of sense, right? It's all forward facing, it's public information. What's we have 28 thumbs up and, we can't. Does anybody want to check with Carol real quick? Cause I know that she's on the way, and see if like she's moments away from walking in, and we can run down our votes at the end here. While we're doing that, does anybody have anything else for new business?
I just had a question, I know I brought it up in Wyoming County, but I know there's the stipend program that the governor passed for some of the fire trainings. Has there been any kind of discussion about expanding that to EMS, as we're talking about like recruitment and retention? In terms of folks going through the training, all that?
So there is, there was two revenue lines attached to the program agency contracts. One was recruitment and retention, that's the 15,000. The other is specifically paramedic school scholarship.
Yeah.
Two people at 20,000, not each total. I think that was the budget spend statewide on that. I don't think they've attached anything else. Ms. McCartan might have an answer.
So, not a lot of people read the educational policies, which it is whatever. But for the last year and a half, 2 years, have been, educational pilot programs for funding. So one of those is if your organization creates a, sorry, the word will find me in a moment. But it's like an introduction to your fire company. It's, it can be whatever you want it to be. It just has to be like 12 hours or something. And if somebody comes through and does that, you can sign a verification of membership form to pay for them to go through class.
Yeah,
The other, educational funding policy they have is, or pilot program that they have, is if you have somebody that joined your agency that paid out of pocket for their course, after 1 year of service, paid or volunteer, they can get reimbursed up to $850 through the agency.
Mr. Atkins, you had,
Yeah, just a couple of communications things, they came out through UVMD. There are, about 10 in Erie County right now, they're called Vive. It's a company, it's an AD, it's a little bit bigger than a cell phone. The Vive is just another company. What they've done through UVMD and Dr. Hassan, they are out teaching CPR and they do some sort of vetting process. They're identifying individuals to carry this personalized AED. Push notification is done at the dispatch level to these AEDs, and if they're within a 2-mile location of a cardiac arrest, you're gonna see them show up. They're vetted again, they take a CPR course. Somehow, I don't know the exact process, but they will show up and they will provide pre-arrival AED intervention and CPR.
so they are, they're actually all qualified CPR instructors, everybody who's in the program. And a lot of them have clinical backgrounds as well, as nurses and, I believe some athletic trainers and some, other training. It is a 1 mile radius that the Vive constantly reports GPS location.
And if you just increase it to 2.
So that's an update.
Yeah, that is the update. So there's a technical glitch, there's like, there's no massive training push, but all the dispatchers will get that. Hopefully by Monday, as far as, the technical glitch work out. So every dispatch center, at least in the Erie County realm right now, can activate that button. They're mostly concentrated right now in the city, the west side of Amherst, and I think there's one down in Blaisdell. They're looking to see if they're reaching, where they are right now, the EDs are reaching the appropriate resource, but the county is also going to supplement them, and next year, we're gonna add an additional 30 of these AEDs into the system, so it's gonna be a continuous growth program.
And that's every PSAP can every PSAP in Erie County
Correct.
can activate it.
We attach it to our Rapid SOS platform so that every dispatch center in the county will use that.
And does Rapid SOS integrate with Pulse Point, or is that,
It does, yes. The Pulse Point, the county purchased as well. That's public access defib. We were just waiting to roll it out until the new CAD software comes out.
Okay.
Because we bought the hook for that and not sure if it was gonna take 2 years to roll out, but that is, it's planned to be there, that everything is set up and in line, but we're just waiting for everybody to keep building out their CAD system. So at the latest, that'll be in November of 2026.
okay. For those who aren't familiar with Pulse Point, it's basically an app that anybody who's CPR trained can register on, and it uses that same location function. And if you register on it and say, yes, I'm willing to respond, and you're in a grocery store, somebody goes into cardiac arrest, there's an AED alarm or a dispatch, you'll get pinged as close enough to respond to that and can get there. So for all of us that are acting in the, well, now I guess we're all gonna be second responders as that's happening. But acting in professional response capacities, recognize that, there is a very good likelihood that we will frequently encounter lay people with CPR training who were willing to assist, had the required training, and have signed up through an app that, engages them. So, I guess this is we're crowdsourcing resuscitation.
Yeah, both companies have, it's a QR code that will be on the device or the app for a Pulse Point that responders, the responding agency anyways, can take and get their information, their pre-arrival status as far as what their initial rhythm was and all that information can be immediately downloaded. How that downloads into your tablet, I'm not that technical, but it's a good idea. And then the other thing is just building off, as we're getting into the comms plan for that, region-wide MCI plan, we're just looking to see, it'll go out, and it's realistic, and probably not right, but it's easier to do it that way. It's just a simple Google form. We're just trying to see primary channel, operating channel, if you have 340 actives. We try to build out a column.
Thank you. Anybody else? Anything for your business? Was anybody able to obtain an update on quorum?
Carol. Sir. Talked to her a couple of minutes ago. She said 5 to 10 minutes she'd be here.
We will sit here in awkward silence for about 4 minutes and, if we don't achieve quorum, then we can, adjourn in the absence thereof. Anybody have anything interesting to talk about? World Series? Go Bills.
Okay, so one thing back to the MCI, just kind of an interest for folks. Which is something that none of us at the onset would have imagined it, we still got 2 pages. So, that's in 2 months after the event. And we've got a husband and a wife from overseas that went for rehab for rehab. One to paracetamol for stomach, one came back for more surgery. So, there's a whole bunch of little tidbits that were not considered because I haven't asked the finance folks to actually run the bill yet. But, yeah, it's going to be a really big bill. But 2 of the folks that were discharged have actually come all the way from Jersey back to Buffalo for follow-up in our clinics because they didn't want to be followed up at clinics at like Robert Wood Johnson or in New York City. Which is kind of a pat on the back.
Excellent. Yeah, there was a lot of complexities to that incident that I don't know that the statistic tabletop engineer could have created all the permutations that ended up unfolding there. That was pretty amazing with the language barriers and the bus issues and everything else. So,
But everybody that made it to a hospital will be home at some point in time.
fantastic. Okay, at 18:45, we have quorum, so I'm just gonna back us up to entertain any motions appropriate at the beginning. So the first one would be a motion to approve the July 9th and August 27th minutes with the amendment to correct the spelling of Crystal and Robert Tatarka's last name. Mr. Maxian, Mr. Skoda, on the question. All in favor?
Aye.
All opposed? And any abstentions? So carried. Correspondence we reported on, back to the treasurer's report, entertainment motion to approve. Mr. McCartney, Mr. Tarka. On the question. All in favor? All opposed? Any abstentions? Motion carries. No motion on medical advisory, state council, Erie County, Wyoming County, Western New York stress, Wyoming County stress, budget, membership systems, training ed, would entertain a motion for the training ed committee to partner with UBMD to construct, distribute, and progress the the paramedic education, program. Mr. Ellis, Ms. LG, on the question? All in favor? LG? Opposed? Abstentions? Carried. So Chris, when you're listening to this later, if you can assemble the training and ed committee and get them with Mr. Shaw to move that forward. Nothing on bylaws, no motions there, no motions on awards. Recruitment retention, to entertain a motion for the recruitment retention committee to engage with Mr. Shaw to do the same analysis, design, and application back to the council for the recruitment retention grant. Moved by LG, second by Zagoda. All in favor? I'm sorry, on the question? All in favor?
Aye.
Opposed? Abstentions? So carried. Nothing on executive board. We did the program agency. Entertain a motion to update the MOU with UBMD to reflect current dates and not change any of the other conditions or terms. Mr. McCartan, Mr. Ellis. On the question? All in favor? Opposed? Abstentions? And Mr. Shaw, would you shoot that over me when you get a second? We'll clean that up. Entertain a motion to postpone our election of officers to January to get the nominations report. This, I'm
Freedauer.
Thank you. That's not my brain, obviously, was on your maiden name. Ms. Freedauer, and second, Mr. Zgoda on the question? All in favor? Opposed? Abstentions? Motion carries. And finally, we can table it or entertain a motion or just ignore it. But would entertain a motion if somebody wants to make it to update our website to allow for more flexibility and easier council management with a price of approximately $1,500. To be safe, I would say let's not exceed 2,000. That's our target. Mr. Alice, Mr. Tarka. On the question? All in favor? Aye. Opposed? Abstentions? Okay, Chair Elects report, did you have that?
Yes, I'm here.
Well,
And Major quorum.
yes, you did, and we appreciate that. Okay, does anybody have anything else to report or motions to be made? Hearing none. Motion to adjourn. Mr. Zgoda. Mr. Tarka, all in favor? We stand adjourned until 1800 January 9th, same location. Thanks.